Good morning and welcome to Stratasan's webinar, a comprehensive approach to service line growth. My name is Drake Jarman and I'm joined by Sean Conway.
Hey guys.
And we appreciate your joining us today. I hope everybody is staying warm out there. It's frigid here in Nashville, Tennessee, and obviously through most of the country. So I hope everybody is bundled up. For those of you guys who are unaware or don't know much about Stratasan, we work with 700 hospitals in 40 states throughout the country. We help these hospitals with strategic growth, and these hospitals span from larger urban systems to ex-urban and suburban systems, as well as more rural and one-off hospitals. So we work with everybody from your 1,000-bed teaching hospital all the way down to a critical access hospital. The ways we help these hospitals is primarily through three avenues. On one side, we have an analytics platform. This analytics platform lives on top of state data and Medicare data, and it is used to help you guys understand your market share as well as demographics and projections and other things to help you guys understand your market so that you are poised for strategic growth. The second lane that we swim in would be our SRG, which we call Spark Services. SRG stands for Strategic Resource Group, and that is a team of analysts that is designed to support our hospital partners. They do so by building some of the decks that you're going to see today. They map a lot of data, and their whole job and mission is to really push you guys through strategic planning and marketing and physician relations up the value chain so that you guys can make decisions more quickly. The third lane that we swim in is going to be our physician pathway tool. And this is a tool that is going to help you guys look at inbound and outbound referral volume and patterns, as well as what procedures physicians are completing, as well as where they are completing them in terms of hospitals. And so this is designed to really help you guys understand, what's happening in your physician market within your system. Today, we're going to cover a specific challenge, and that challenge is how to align strategic planning, marketing, and physician relations to bolster orthopedics. We're going to do a case study on Winter Haven Hospital, which is an independent hospital facility in Winter Haven, Florida. The topics that we will cover today will be the data and tools that we use. We're also going to show you how to use those tools to create an orthopedic, in this case, orthopedic deep dive, with targeting. We're also going to work with you guys on how to use a physician relations tool to target specific physicians to increase growth of a specific service line. And then we're also going to show you guys the fourth thing, which would be tracking your patient volume in real time. This is going to give anybody in strategic planning and marketing a real leg up to prove ROI and to make sure that your campaigns are doing well. We will then conclude and have an opportunity for questions here at the end. But before we jump too deep, I want to start with a poll. And so we will launch a poll on the screen. And that would be, what product line are you focusing on? So it looks like we have about 50 attendees today, all the way from California to New York to Florida. For those of you in Florida, I am very, very jealous. And so we just know that the rest of us are very, very cold right now. But if you would, please select which product line you are focusing on, and that will help drive the conversation today. And we're at currently 68% have voted, and so it's not quite a quorum just yet, but we're on our way. All right, looks like 68% is what we're going to get, and the results are 77% of you are focusing on orthopedics. Well, good news, today is a case study on orthopedics. Looks like the remaining 23% who voted are focusing on cardiology these days. Oncology and OB doesn't seem to be a big focus, a primary focus today, but this product line toolkit would also help you with those features. So as we jump in, we want to talk big picture, and with this we are going to start really big picture. We're going to start with how the three, both strategic planning, marketing, and physician relations are aligned. And we really see this, as many of you guys know who work with Stratasan, you guys know that we call ourselves Stratanauts. So we did have to start off with a little bit of a cheesy drawing of a space shuttle here. and this is how we're going to explain the alignment of the three. In the cockpit, you have strategic planning, and so those folks are determining the direction and they are monitoring the plan. They are diving into both your internal data, the state data, as well as projections, demographics, and psychographics to really chart the course. On the left engine, we have marketing. And with marketing, you guys are going to be taking that strategic plan, taking that targeting, and really dive into execution, whether that be through digital, mail, screenings, more traditional methods, as well as targeting to boot. And so in this case, you guys are the left engine, but many of you guys know, a space shuttle, an airplane, can't take off with one engine. So it does need another engine, and that is going to be our physician relations team. And we're going to deploy that team to build relationships, targeting doctors in the market to drive referral volume back to the facility. With these three entities aligned, you guys are really poised for strategic growth, and you take off, so to speak. So let's talk a little bit about the hospital. Let's give a little bit of a background on the hospital. Winter Haven Hospital in Winter Haven, Florida is a 527-bed independent facility. Their primary service lines are your nuts and bolts kind of community hospital there. Pulmonary, cardiology, OB, general medicine, and obviously orthopedics. For those of you guys dreaming of warmer temperatures, you can see that obviously it looks very warm there in Winter Haven. However, they are right there in the middle of the state of Florida, to the east of Tampa and directly east of Lakeland. And Lakeland is going to be kind of the CBSA that they are a part of. So to jump back a little bit, we are first going to start off with the data and tools used to help you guys understand the tools in the toolkit, so to speak. The first thing would be our data sources. So what data sources are we going to use in today's webinar to really drive to the results that we hope to get? And so in this case, we are using AHCA, which is Florida's Agency for Healthcare Administration. That would be very similar to any of the states out there that have hospital associations, Tennessee Hospital Association, Georgia Hospital Association, and so forth. These are the folks that, for the most part, compile your state market share data. And so that will be the primary source for our market share data. We are also going to be using Winter Haven's internal patient data. Now, bear in mind for today's webinar, this is masked data. We're not sharing anybody's actual internal hospital data. The third source of data that we're going to use would be our demographic supplier, which is Esri. As you guys know, Esri is a very large demographic supplier. There are a few other demographic suppliers out there as well, but that is who we'll use for today. The data tools available to you guys, obviously for today, we use Stratasan Analytics platform, but there are other tools that can get you guys to similar results. I'm biased, I don't think better results, but similar results. And so that would be SPSS, Microsoft Access, a SQL Server. The advisory board has a tool, Truven, SG2, and Telemed, and a few others are out there as well. For mapping, we use ArcGIS, which is an Esri platform. But you could also use Maptitude, MapInfo. We also could use Tableau. Microsoft also has a product that has been sunsetted, but could also be used. And then finally, for presentation, we simply used Excel and PowerPoint. And so really for today, these tools that we use for this hospital system are all very easy and accessible to you guys to be able to accomplish your goals for strategic growth. Now we're going to start diving into the data. And so we want to start big picture. We want to start big picture by looking at state data. Then we want to look into your internal data. And then we want to get deeper and combine your internal data with some projections as well as some demographic and psychographic data. This will occur in the orthopedic deep dive as well as targeting piece. Now, before I jump too deep into this, it's important to note that within this webinar, we are assuming that you have the ability to pull data, whether it be through our analytics platform or another, and put them into PowerPoint. If you guys would like a tutorial on how to do that, please contact me, and my contact information will be at the end of this webinar, and we can talk to you about how to query data and so forth. As well as we also assume that you have the ability to map. If you don't have the ability to map or are unaware of how to use mapping applications, please feel free to contact us. So as I mentioned, we're going to start bigger picture, and we're going to get deeper and deeper and deeper so that we can ultimately target block groups within our service area. And I'll explain what block groups are here in a second. But step one, we'll be using ACA data, and this is going to be to understand really your market share, where your patients are coming from, where your competitors' patients are coming from, and where leakage occurs and things of that nature. Step two is when we will bring in your internal data, and that is when we're going to geocode that internal data to the block group and really look at your internal volume at a smaller and tighter geography than a zip code. Step three is when we're going to bring in demographics and psychographics to help round out your internal data as well as the market data so that we can start to make some very transparent projections to help you guys target the best areas in your service area, which is the overall goal of today, is to really help you guys go from a spray and pray process into direct micro-target marketing and tracking of patient volume. Step four will be when we actually crosswalk all of that data together and really present to you guys, these are in today's case, 5 best areas to target for orthopedics. And so we're going to do a step-by-step process from big picture all the way down to small and talk about how we align the 3 areas. So starting in this area, this is really a strategic planning area. We're in a orthopedics product line deep dive, and we really want to get a lay of the land. We want to educate ourselves on where our patients are coming from and to whom they're going to. So to orient you guys a little bit closer, we have Winter Haven Hospital. The blue zip codes here are their primary service area. The green are their secondary service area. Their top 3 competitors are going to be Heart of Florida Regional Medical Center, Lakeland Regional Health, and Lake Wales Medical Center. You'll notice that 2 of those 3 top competitors are not located in their service area, so any patient that originates in their combined service area, which is their primary and secondary service area, is going to be considered leakage or outmigration to a different facility. We also want to orient you guys with drive times. Lakeland's traffic is not quite like Nashville traffic. And so with that, you can get pretty far within this 15-mile radius. You can see we're setting up this drive time. Obviously, as you start to look into this 15-minute radius here, you're going to notice that this is going to be our primary service area for the most part. As we start to get further west or north, we're going to be closer to these other more competing, bigger competitor hospitals. Now today we are focusing on orthopedics. These are the total market discharges in the service area here on the screen. So this is not just coming to us. This is going to everybody in our combined service area. And we are highlighting orthopedics because it is a nice, in terms of volume, product line for us. But also you'll notice we've had a nice dip, or not such a nice dip, if you would, as we go through. And so we are losing market share in orthopedics. We'll also show you guys what that market share specifically is, and this would really help as a strategic planner or as you talk to your C-suite on why this is important. Why are we focusing on orthopedics? Well, it's in the top 6 product lines in this service area. We have 510 discharges in our combined service area, which is only 22% market share in our combined service area. That's a real challenge. When you've got other hospitals, we'll show those other hospitals here in a second, really taking a lot of our market share, but that is a fairly low market share, and it is inconsistent with the rest of our product lines. You can see pulmonary is the #1 product line in the service area in terms of volume. However, we're at 41%. So we have a real challenge here with orthopedics. We do not provide OB very often, and so that is not a product line that we are going to focus on. Another nice feature here is going to be the potential revenue that we could pick up with a 5% market share increase. So we know that the incremental volume to get a 5% market share increase is going to be 116 cases of orthopedics, and that would yield $2.3 million in potential revenue. So in terms of product lines, this is our greatest potential revenue. We're going to get pretty detailed as we go through, so I'm not going to dive into each slide as heavily with all things on each slide, but I do want to highlight 33881. That is our home zip code. Within 33881, we are only getting about 31% of the market share, meaning we are losing 214 patients from our home zip code. That is going to be a challenge, and that's going to be something we want to target as we push through, but obviously lost cases is a key component on how we choose how to target patients. So first, we're going to, as we continue on, we're going to look at lost cases, we're going to look at market share, we're going to look at volume, and obviously we're going to look at payer mix. And this is going to really create a lay of the land so that we can create a strategy to find the best areas to go after. So mapping orthopedics now. And as I pause real quick, please note that there is a question opportunity. So if you guys have questions in the platform, just please let me know and shoot me a question. We may or may not answer it depending on how hard the question is, but please feel free to ask questions as we go through. So as we look through here, we can see our home hospital, and we can see through this gradient where the vast majority of our discharges are coming from in orthopedics. And this is for the combined service area. This isn't our discharges, this is overall. And what's nice about that is we can see that there's healthy volume around our facility. But as we start to look at our volume, you can see, yes, we are getting most of our patients from this area around the hospital. But when you look at where everybody else is getting their patients as well, it is also heavily around our hospital as well. We're doing a little bit better in these two zip codes to the southwest of our system, but particularly to the north, our home zip code 33881, we are losing a lot of patients, and so we'll need to see that. So we're actually going to map market share to do so. And when we map market share, we're going to do so on top of that volume. And so you can see 33881 there has 313 cases. We're going to do a pinwheel here to show this market share, a pie chart, so to speak. And you can see we are the blue, and so we are the market leader here. But we also see the green here is Heart of Florida Regional Medical Center, and they are nearly equal to our market share in this zip code. And so our challenge with this zip code is clearly patients going north to Heart of Florida, which is interesting because the town center is definitely down here closer to our facility. We're also going to look at market dominance. This is going to be great for your executive team to see what zip codes are we winning and by how much. And so you can see the blue, we are the blue hospital. Winter Haven is going to be the blue hospital. And we can also see which other hospitals. The green is Heart of Florida. The gold is Lakeland Regional. Then we're going to also see our overall market share. And then we also want to see that in a table, right? So this is going to be our primary service area, our secondary service area. And so you can see that our discharges in orthopedics are dwindling, unfortunately, as is our market share from 34 to 29% in 3 years. That is really on the heels of Heart of Florida, the hospital to the north that's green in the maps, going from 225 to 286. That's in our primary service area. That's where 33881 resides. Combined service area, our market share is obviously dipping as well. And that's when we combine the primary and secondary service area. You can also notice that outmigration is pretty significant here as well. And we do define that as patients who are leaving our service area to another facility. As I mentioned earlier, both Heart of Florida and Lakeland Regional are considered outmigration because patients are leaving our service area to go to other facilities. Furthermore, we're going to look at our discharges by facility. They're on the uptick, we're on the downtick. Market share, similarly, we're on the uptick, or excuse me, they're on the uptick, we're on the downtick. The next thing we want to see is at the zip code level, let's compare 2015 to 2013. And so now we're mapping patient discharges for our combined service area, but then we're also going to look at the payer mix. So we've obviously seen a dip here for us in our combined service area of 38 patients over the past 3 rolling years. Before we get too deep, we also want to look at the payer mix in the service area. And so what we can also see is this payer mix in 33881, which is what I'm going to focus on, as I mentioned, is very heavy Medicare, and then which is blue, and very heavy for this market, commercial. There's very little Medicare, other, and self-pay and charity. And so as a strategic planner, when we are focusing our marketing team on how to and where to market our services, we're obviously going to want to be marketing those services to commercial payers primarily and to Medicare payers as well, particularly in Florida where Medicare is so prominent. And so we want to make sure that we go after zip codes that look like this as opposed to this zip code to the south, which has a much higher Medicaid payer mix. Now, looking at Winter Haven Hospital's CSA, we can see that in the CSA, our payer mix and volume is relatively the same overall. But then we start to look at our own internal in the CSA, and you can see our commercial and our Medicare are dipping, and our Medicaid is increasing. And so many of you guys out there know that if you guys are going to be, really marketing to patients and looking at the health of a service line, these two pairs on the left here are going to be very, very important. Now, before we get into the targeting, the last piece I really want to look at is going to be sub-product lines. What sub-product lines can help us drive growth? It's easy to say, hey, we're losing in orthopedics, but what is it within orthopedics that we're losing? And where's that leakage occurring, so to speak? And here we can really see that in the CSA, and this isn't our patient data, this is ACA data overall in our CSA, we can see that orthopedics joint replacement and revision is the #1 product line, and it is on a massive increase. We can also see that our market share has dipped in that product line in the past couple of years. Furthermore, out-migration in that product line is also on the increase. So you can see in 2013, 628 patients for this product line, specifically sub-product line, left our service area, and now it's up to 769. So that's a real challenge in terms of out-migration. We do have a couple of pieces here to really get deep into that data, and this is going to help you guys in case you want to look at a physician supply analysis, and it may be a situation where you don't have the doctors. But for today, we definitely do have the doctors. Winter Haven has the doctors. It's going to be a targeting and referral issue as well. So now that we really understand the lay of the land, we know where the commercial payers are, we know where leakage is occurring, we know to whom it's occurring, we know on what scale it is occurring, and we've really seen that we've had an uptick in Medicaid and a downtick in commercial and Medicare. Now it's time for you guys as strategic planners to start to arm the marketing team with picking specific block groups to target. And so I'm going to jump into giving the answer key here at the beginning. And we're going to focus on 5 block groups that this hospital needs to target for orthopedics. Those block groups are A, B, C, D, and E. Because you guys don't want to spend all day with me today and Sean and I are going to focus on block group C pretty heavily as it exists right next to the hospital, and it is in 33881, the zip code that our hospital resides in. Also, I want to mention what are block groups. Oftentimes folks have questions, what are block groups? Most healthcare planners and marketers are used to looking at things at a zip code level. Block groups are a little bit different than that. Zip codes are drawn with the U.S. Postal Service. They do change, but they're drawn primarily based off mail routes. Block groups are actually part of the Census Bureau, and block groups are redrawn every 10 years. They're very similar to a census tract. Census tracts tend to be bigger, and census tracts tend to be more based on population density. Block groups are drawn literally as a group of blocks. And the Census Bureau draws those blocks based off of types of people. And so they use socioeconomic traits to create these geographic barriers that create what is now a block group. Also, it's important to note that block groups also have specific unique identifying numbers, very similar to zip codes. Block groups do change every 10 years based off socioeconomic traits. So the folks that live in block group B tend to be birds of a feather who flock together. They are very similar types of people. Similarly with block group C, now folks in block group C are different than block group B, and we'll discuss that here in a little bit. But before we jump too deep, we can see that we're going to target these 5 block groups. And once again, if anybody has questions on that, please feel free to ask questions in the questions box. So now we're going to start looking at your own internal data. And this is a situation where we take the data, or you guys can take data out of your electronic medical records. It's going to be address level data with DRGs or ICD codes attached to them. Payer, we typically, when we geocode data, we take off the name and social. But when we do this, we map it down to the block group level. So the tapestry that you guys see through here, each of these different panes in the tapestry or tiles in the tapestry our different block groups. And so you can see at the block group level where we are getting our patients. And so you can see block group C does exist right through here, and we're not getting a lot of patients there as compared to this block group just to its east. As we now we're at our next poll, our second poll, and so that the question there is going to be, do you use your internal data to look at your patient volume, and do you map that data? So yes, question one would be yes, we map it to the block group or rooftop. Answer two is going to be yes, but not as well as I'd like to. Number three is going to just be a yes, and number four would be a no. And so right now we are at about 50% voting. Hopefully we can get back to 68% like last time. All right, we are approaching the magic 68 up, and we just hit it. So of the responses, it looks like 64% are using your internal data, but not as well as you'd like to. 0% are mapping it to the block group or rooftop level, and 7% are just using your internal data, and 29% are not using your internal data. A little bit about internal data. Everybody knows about ACA data or your state data, and whatever state you may be in. Your state data is obviously more market share and is at the zip code level, and it is obviously oftentimes very historical. We have data from 40 different states, and I think the most current is Q2 2016. Your internal data is down to literally the rooftop level, and you can you can map it in many different ways, and it is as current as you can get. And so we see that internal data being the most robust, best data source to use, and it is the data source that in strategic planning you guys can really prove what's happening in a real-time basis when you compare quarter over quarter. And so we will show you guys how we do that. Now, as we go through, we're going to be looking at your discharges by block group again. And so you can see block group C is healthy currently, as is A, B, C, D, and E. And so literally this means that 10 to 12 patients come from block group C. And now we're going to get into the block group estimating process. And this is kind of the step 3 piece as we start to get deeper. And we're going to start to see, we're going to start to see at the block group level what kind of patients you guys have and what kind of patients there are, so that we can draw conclusions on use rates for the block group level. And so what we can see here is total discharges in 33823 in this case. We have the stratification of the 115 males. So now we have a use rate for this block group based off males as well as females. And so then we can then extrapolate down to the block group level using some simple Excel to get a utilization rate at the 33823 level. When we have this utilization rate at the zip code level, we know at the block group level how many of each of these types of people lives in each of those block groups through our demographics provider. And so in doing so, we're able to take the total number of cases for that zip code. As you can see, we have a total discharges, we have a total population, we have a utilization rate as a result, and knowing the utilization rate for each of these types of folks in each block group, we're able to get a total number of cases at the block group level. And so that allows us to take state discharge data, which is at a zip code level, and extrapolate it down to the block group. You guys very well know that through the state, how many cases you have or don't have in a specific in a specific zip code. And so what this allows you guys to see is much deeper down to the socioeconomic traits of those people, how many patients you're getting, how many patients you're not getting. So now we're going to look at total market orthopedic discharges by block group. So this is the overall, and then we're going to look at non-Winter Haven, so where were we losing patients at the block group level using that utilization rate, both of these using that utilization rate, breaking the zip code down into block groups. So we can see where we're not getting patients at the block group level. And now we can see what our market share is at the block group level. And obviously this is a projection, but we've walked you through that projection to get a use rate based off the demographics at the block group level. And we can obviously see at the block group level, we are not doing very well in block group C. So we're going to focus on block group C. The other thing we can also do is extrapolate using similar methods the commercial payers at the block group level. And so we can see that block group C is fairly decent for commercial payers, but we can also see that B and D is great for commercial payers in total orthopedic discharges. The next thing I want to look at is the summary of these block groups. And so as I mentioned earlier, block groups have unique identifying numbers. That is going to be block group C's unique identifying number 121.050.137.021. We know the estimated orthopedics volume at the block group level from our projection. We know from your internal records how many patients you guys had. We know your market share at the block group level, and we know the potential revenue at the block group level that we are losing based off of potential charges. We also obviously know the demographic statistics, population density, etc., on those block group levels. Finally, once we've picked out, in this case, these 5 product line, these 5 block groups, we want to be able to supply the marketing team with demographic and psychographic data on who lives in these areas. What is the total population in these areas? Is the area growing? And then finally, what is the median age? What is the median household income? And then we want to look at the psychographics. So some of you guys are familiar with psychographics. This is really how you guys, from strategic planning, align yourselves with the marketing team. Psychographics are going to be the who lives in these areas. So demographics are going to be the what, age, sex, race. Psychographics are going to be who, as in, do these people own or rent their home? Do they own or lease their car? Did they go to college? How many kids do they have? What do they watch on TV? What do they listen to on the radio? What are they looking at on the internet? What magazines do they look at? What types of people live in these areas? And so you can see through the block groups that there are different types of people throughout. Block group C is Gen X urban, and it's which is folks that are usually 45 to 55 in this case. And so that's a very great group for orthopedics in this case. And so we would want to target them with messages and ads and through methods that would speak to a Gen X urban type person. If we look at block group B, for example, that's country cozy living. We'd probably want to target them on Fox News and other elements such as that. So what we do when we break this down is we actually provide you guys a full deck with the characteristics, in this case, of block group C. And we also provide a who and what report of what types of people these are, as well as what websites they go to really fuel your marketing team so that they know the types of people so they can craft the message for this specific group. Also, we give them the location so that they can target this specific group. And in doing so, speak their language in the mediums through which they're consuming media. So we really want to eliminate the spray and pray and just say, let's litter the market with orthopedics. We want to go specifically in this case after commercial payers in our service area where we are losing patients. So that would be the targeting portion, and that is how strategic planning fuels the marketing team and really empowers them to then engage their platform to really reach out to your team, to your areas. The other side of the equation, the other engine, so to speak, is going to be how are we going to align with the physicians in the market? How are we going to target specific physicians, and who are the right physicians to target to bolster our orthopedic product line? So for this, you're going to need some tools to look at this, to look at physician relations in the market. There are a lot of tools out there. The Advisory Board, SG2, eVariant, MarketWare. There's a few others out there as well. These are kind of the tops, along with our product, Physician Pathway. And before we jump into the Physician Pathway tool, we want to see what tool you guys are using. And so we're going to launch our third poll. All right, 16% have voted. Wow, that was quick. 37, 47. And we're up to the magic 68%, 74%. That is great. You guys are engaged on this one. And so it looks like 27% of you guys are using Stratasan's physician pathway. Thank you very much for that. 20% of you guys are using eVariant. 33% of you guys are using the advisory board, and obviously the advisory board with Crimson or Planning 2020 really created this market for physician relations. And 20% of you guys are not using any, and looks like nobody's using the other. So thank you for that, responding to that. So with that, we will jump into physician pathway. Let me pull our platform up. And we are pulling it up on the screen as we speak, and it'll be live here in 2 seconds. All right, I'm going to introduce Sean Conway, who is our product specialist for Physician Pathway.
Hey guys, again, thanks for joining us today. So now that Drake has gone through the orthopedic deep dive and the micro-target marketing, we now understand that we are losing patients in a variety of different ways. We know that we are losing market share in orthopedics specifically. We know that Heart of Florida, just to the north of us, is gaining momentum and gaining market share in our market. And we really want to combat that not only from a marketing perspective, but we want to combat it from a physician relations perspective. And obviously, using micro-target marketing, we were able to pinpoint and use that block group C and figure out that that is a block group that we are losing patients. So now from a physician referral standpoint, let's figure out where we're losing patients and from what physicians. We know that Heart of Florida is gaining momentum. So let's take a deep dive into that. And how we're going to do that today. So this is the landing page for Physician Pathway. Over here on our left is where the physician you'd like to analyze. This would be their MPI number, a specific name, a city, or a specialty. And for today, I'm going to choose the Find Physicians perspective. And what I want to do is I somewhat want to work backwards. I know for a fact that Heart of Florida and their orthopedic physicians are performing more work in orthopedics. So I want to run a report on their employed physicians, not cardiologists, orthopedic physicians. And I really want to see exactly where they are getting their patients. So I'm going to use the city name option for Find Physicians, and I'm going to type in Lakeland, Florida, as a CBSA, which includes the Winter Haven. And I want to look at all orthopedic, if I can spell, orthopedic surgeons in the Lakeland, Winter Haven market. So now over here on our right, we have a map that shows the office locations for all the orthopedic surgeons in the Lakeland, Winter Haven market. And over here on our left is where each individual physician in that market has their own individual cards. And this is where we're going to filter down and choose those specific physicians we'd like to analyze. So as I said earlier, I want to focus on the Heart of Florida orthopedic surgeons. So I'm going to filter down the primary hospital affiliation to Heart of Florida and pull all of those orthopedic physicians that produce work at Heart of Florida. So I'm going to choose Dr. Samuel and Dr. Paul at Heart of Florida, and I'm going to run a report on those two physicians. And as you can see, it looks like Dr. Samuel has a clinic in the heart of Winter Haven, but he is producing a majority of his work at Heart of Florida. I'm going to name this report. And while this is running, it usually takes about 1 minute and 45 seconds to run. And for the sake of time today, I'm going to go ahead and pull a little cooking show technique and have this report already run. So here's Dr. Paul Dowdy and Dr. Samuel at Heart of Florida. And we ran a report on those two, and we really want to figure out where they're getting their patients. So I'm going to jump right into the referrals report. And I'm going to leave it at inbound, but we can obviously switch it to obviously, we can look at it inbound and see what physicians in the market are sending these two physicians patients, or we can switch it to outbound and see exactly where they are sending their patients. But I'm going to leave it at inbound, and I want to see what internal medicine doctors are sending patients to these orthopedic physicians in the market. So I'm going to leave it at inbound and click see details for internal medicine physicians. And now we have a list of all the internal medicine doctors who are sending patients to these orthopedic physicians. And lo and behold, we have several doctors from Winter Haven that are sending patients to Dr. Samuel at Heart of Florida. So looking at this particular page, that is an issue from an internal perspective. We have some leakage from Winter Haven, from our primary care physicians that are sending patients to Dr. Samuel. And to take that one step further, we're looking at internal medicine currently. Let's go ahead and take a glance at family practice also and see what physicians from a family practice perspective are sending orthopedic patients to these two orthopedic surgeons. And again, there is another, Dr. Ronald Ford from Winter Haven is also sending 22 patients to Dr. Samuel. So that's somewhat of an issue. We need to take a deeper dive into those particular Winter Haven primary care physicians. So what I did is I essentially copied and pasted all of these names from Winter Haven, and I ran another report. So I'll quickly show you how I did that. So I'm going to run a new report. I'm going to click I know my physicians, and I simply copied and pasted those 5 primary care physicians from Winter Haven who are sending orthopedic patients to orthopedic surgeons at Heart of Florida. Simply copied and pasted their name and ran a quick report on them. So I'm going to go ahead and pull that report up. So here are those 5 primary care physicians who are sending patients to Heart of Florida. And as you can see, there are 3 right here in the heart of Block Group C, essentially. So it makes sense now that we know Block Group C is there's some issues in that particular block group that patients are leaving there and going to Heart of Florida. So I'm going to jump right into the referrals report also for this one, and I'm going to choose outbound, and I'm going to click orthopedic surgeons to see where else these guys may be sending their orthopedic patients. So I'm going to click see details. And now we have a very objective look in that we know that these 5, these 4 internal medicine doctors and this one family practice doctor are sending patients out of network. Obviously, they're sending several patients and keeping them internal at Winter Haven. But when we use the filter option, we get a better grasp on the amount of patients that are leaving. So up here at the top right is a command center for this particular report to be able to filter down and again, choose specific facilities that we want to look at from a referral standpoint. So I'm going to go ahead and remove all for right now. And I want to look at Heart of Florida and also the South Florida Baptist Hospital. So now we can see Dr. Baker, we'll highlight this physician for right now. 50 out of her 79 Medicare orthopedic patients are leaving Winter Haven and going to either Heart of Florida to Dr. Samuel, or they are going to South Florida Baptist Hospital to Dr. Goldsmith. So from an internal perspective, I'm a physician liaison at Winter Haven. I'm seeing this data, I'm running these reports, and I'm finding internal leakage from my primary care physicians. So, the first thing I'm going to do is I'm going to go set a meeting with my internal physicians and figure out why patients are leaving Winter Haven. Is it patient choice? Is it scheduling? Do we not have enough orthopedic surgeons? Or, is it facilities? Whatever the case may be, using Physician Pathway, you now are armed with that objective intelligence to know that there are patients who are seeing your internal primary care physicians and are going out of network and going to Heart of Florida just to the north of you guys. So that's an issue, and that's where Physician Pathway really plays a big role in that in that demonstration using the space aircraft to align your marketing and physician relations to boost whatever service line you have for that particular time.
Great, thanks, Sean. And so now that we've fueled or armed, so to speak, our marketing team to go after these block groups and our physician relations team with objective data to go after the right physicians, what is the result? How do we track this? How do we see this in real time? And for those of you guys who are not using your internal data, this is a real opportunity for you guys to really track that internal data so that you can see how we're doing. So I'll play from current slide. And now we get into the tracking piece. And this is really where things get pretty important. So just to remind you guys, block group C is right here, and that's what I will focus on. Primary service area, secondary service area. And now as we go through, we can start to see our total discharges since the campaign date. So it's been 2 quarters that we started this campaign. It was Q4 2015 to Q1 2016. And we can start to see an uptick in patients. And we're going to plot that out as well. So we're going to see our overall for the hospital using our internal data. We had, like I said, in this case, at this point, they had historical market share data to this point. But we want to compare the current campaign period to the same time in the previous year. Florida specifically, as you guys know, has a large, snowbird community that comes down there. But in any case, you're not going to want to compare the fall quarter to the winter quarter, so to speak. You really want to compare same time periods against each other. And so you can see that in the same period previous year, both our revenue and our discharges, we're starting to uptick. But you can see overall for our hospital that we have increased significantly since the start of the campaign. I want to look at the combined service area as well, and you can see that overall the combined service area has increased as well from Q4 to Q1. From Q4 to Q1. This is great, but how do we do in those 5 block groups? We've invested time, we've invested our resources in those 5 block groups, and this is where the volume that we desire exists. In those 5 block groups, that's where we want to drive volume. That is our ideal patient. And you can see that we had a dramatic increase over Q4 and Q1 of 15 to 16, particularly as it pertains to 13 to 14 in the same period, 14 to 15 in the previous year. And so this is a huge increase in both revenue as well as charges. We can also map that out, and so we can see block group C. Sean went and approached those primary care physicians and did a great job in block group C. He did a pretty good job in D&E and A and B as well, but you can see that we had more than 10 increase in block group C, which is really our home base, our backyard, and so we're going to map that out as well. We're also going to do charts for this as well, and so this is going to be cases by target block group. You can see we've increased all of the cases. But literally, block group C was astounding, and that was really the combination of marketing and physician relations aligned as those engines on the space shuttle, so to speak. And so with block group C in the previous year, we had 7 cases, and now we're up to 23 cases. You remember when I was getting pretty deep into the data, I was talking about joint replacement and revision and how we were having a decline in that. And so we wanted to show that specifically in the campaign period, we had 16 an increase of 12 patients from block group C for joint replacement and revision for a total of 16 cases there for that specific sub product line. That's a dramatic increase because, as you guys know, that is a very profitable business line for this hospital. We also want to look at the charges. Now, obviously, we don't get all of our charges back, but we can see in block group C that our charges went up $1.1 million specifically in joint replacement and revision, but also in the campaign period overall, block group C, we increased by almost $1 million. And so we really, by $2 million. Block group D was $1 million. So we really did a strong, in terms of charges, we did a strong job. And then in terms of actual receipts, that's obviously revenue going straight into your balance sheet. And in that case, we picked up from block group C an additional $632,000 in revenue for a difference of $346,000 over the same period last year. So with that, we're going to jump into the conclusions. Nobody's taking me up on the questions, but now will definitely be the time to start asking them. So the conclusion overall, as you guys know, the challenge was how do we align strategic planning, marketing, and physician relations to bolster orthopedics? Oftentimes in hospitals, those 3 lanes live in different worlds, different parts of the building, or even in different buildings. So we want to align those 3 for strategic growth. And so we built a strategy with the strategic planning team to find where those best 5 block groups would be for orthopedics. We used your state data, we used internal data, we used additional data from demographics. And so in that case, we were able to really whittle it down to figure out what those best 5 block groups were. We then unleashed, so to speak, the marketing team to build a campaign to go after those 5 block groups, and we aligned those physician relations teams to reinforce the message that you are sending to the consumers by sending it to the physicians in the market through the physician relations teams to build that relationship, that you guys have the best quality, you have the most convenience, and you are the most best cost provider in the market. The results, obviously, we more than doubled the cases and charges in the targeted block group, and overall, we increased revenue in a year by $800,000. And so that was significant for this facility, just going after 5 little block groups within their service area, rather than targeting the entire primary, secondary, or combined service area. So right now we have questions. We also have a poll, so we will ask that poll. And it is a wanting good feedback. How do we do? Are we great, good, okay, or no comment? And so definitely let us know how we did. All right, 82% great, 17% good. We'll have to see what we can do to make those goods great, but no okay and no comments, so that's a plus. And then we do have a couple of questions with 10-year gaps in census data. This is from Bill Hancock, who went to my high school. With 10-year gaps in census data, how does Stratasan make sure block group demographics data is current? And so we do that by partnering with Esri. And so with Esri, they are the #1 demographics provider in the country. We can send you a study to do so, but they update their demographics data on a yearly basis, and they have been shown to be closest to the census out of all of the demographics providers in the country. Moreover, beyond demographics, to get the psychographics, they track over 2,000 elements on just about every person in the country. And they're doing that through Target or through any other rewards program out there. They're doing that by buying other data from Nielsen and folks like that to really craft a tapestry for the community to see who lives where. And so that is updated on our demographics are updated on a yearly basis. We had another question. I missed the beginning. Will the recording be available? Sure, we would be happy to provide a recording of this. Or if you did miss the beginning or weren't able to stay on for the entire time, you wouldn't hear this, but I'd be happy to finish it up with you in person as well. So that is that. And our emails are on the screen. So if anybody has any other questions, please feel free to ping me, Drake Jarman, at drake@stratasan.com, or Sean Conway at sean@stratasan.com. And we hope you guys have a very Merry Christmas, a Happy New Year, a joyous holiday season. I want to thank you guys for joining us today and hope everybody stays warm out there.